Hello students, welcome to this session. So chapter 16. So in that universal or standard safety precautions, and in detail we will study hand hygiene. So in universal standard safety precautions, what are these and what are the components of that, like hand hygiene, biomedical waste management, protective equipments, injection safety and all. So these components we will see, and we will see hand hygiene in detail. So first, universal safety precautions. So these are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood or body fluids with non-intact skin or mucous membranes. The components are hand hygiene, personal protective equipments, biomedical waste management, injection safety, routine environmental cleaning, disinfection, then spillage cleaning, respiratory hygiene, appropriate handling of the linen. So these are few important components of the precautions. So let's study hand hygiene in detail. So hand hygiene is washing of hands promptly after contact with infective material. So there are different types of hand wash. So first is social hand wash. It is a common practice we do after using washroom or before the meals. Then second is hand rub. So here it is a use of alcohol based sanitizer. Then hand wash. So it is when the hands are spoiled, so that time we use antimicrobial soap, or then ordinary soap if the antimicrobial soap is not available. And then duration of this is longer than the hand rub, that is 40 to 60 seconds. And then surgical hand wash, before the surgery we do hand wash up to elbow. So this chart shows the types of hand hygiene, then which agents we use, what is the purpose, area and duration. So routine hand wash, the first one. So in that we use usually soap and water. Purpose is to remove soil and transient microorganisms. So area used is hands and fingers. And then duration is minimum 15 seconds. Antiseptic hand wash. So here we use water and soap. Antimicrobial soap can be composed of chlorhexidine, iodine, iodophor, chloroxylenol. Then the purpose is remove or destroy transient microorganisms and reduce resident flora. So all surfaces of the hands and fingers, and duration is 15 seconds. Antiseptic hand rub. So it is alcohol based hand rub, that is sanitizer. So it remove or destroy transient microorganisms and reduce resident flora. And same hands and surfaces of hands and fingers, and until hands are dry. A surgical hand wash is use of antimicrobial soap and water. It removes or destroy transient microorganisms and reduce resident flora. The area mainly it is different. So here it is surfaces of hands, fingers and up to elbow, forearm. So duration is longer, minimum is 2 to 6 minutes. So here you can see the steps of hand wash. So here for the hand rub, when we are using alcohol based sanitizer, so total steps are 7, and for hand wash when we are using water and soap water, then it is, or liquid soap, then it is total steps are 10. So first you have to apply hand rub or liquid soap or soap. Then in step 2 you have to rub palm to palm. Then in step 3 back of the palm, both the sides. Then step 4 between web spaces of the fingers. Then step 5 back of the finger on the palms, both sides. Then thumb in rotational movement, both the sides. Then step 7 you have to scrub your nails on the palms, both sides. And then this is for the hand rub. So for the hand wash, now you have to rinse hands with water, then dry with single use paper towel or tissue paper, and then close the tap with elbow if the handle is there, or with the tissue paper, and then let it dry. So after use of tissue paper. So these are the steps. So first 1 to 7 steps are for hand rubs, and 1 to 10 steps are for the hand wash. So these are 5 moments of the hand wash: before patient, before touching patient, before any technique, then after contact with blood body fluid, after touching patient, and after touching patient surroundings. So these are 5 moments of the hand. So the aim of PPE, that is personal protective equipment, is to determine the equipments to use for a given procedure. The healthcare workers should consider the following factors. So they should know the factors where to use and which personal protective equipment to be used. So what is the probability of exposure to blood and body fluids, or type of body substance involved, and probable route of transmission of infectious agent. So transmission of infectious agent by inhalation or by direct contact or by indirect contact. So this is important. So for direct contact we will use mainly gloves, and for inhalation purpose the main PPE is, that is, mask. So depending on the exposure, type of body surface involved, and transmission of the route of the infectious agent, so these are the factors. So full protective wear including double gloves, protective eye, face shield, protective footwear, gown and apron is recommended for operating room or mortuary procedures. So PPE are used to protect skin and mucous membrane of healthcare worker from exposure to blood and body fluids, and from HCV to patient, that is from healthcare worker to patient during the procedures. So it is to and fro procedure. So transmission of infection from patient to healthcare worker, from healthcare worker to patient. So to prevent this we have to use personal protective equipment, so for the safety of the patient and for the safety of the healthcare worker. So the contents are gloves. So when you're touching blood or equipments, invasive procedures, you have to use gloves, gown or plastic apron while surgery, surgical mask or N95 mask while surgery, droplet or airborne infection, cap, face shield, goggles when the major spillage of blood or body fluids expected, and surgical shoes in ICU or operation theatre. So first is gloves. So use of disposable gloves is part of the standard precaution. The uses are as part of personal protective equipment. Gloves prevent contact with blood and body fluids and mucous membranes. They also protect patient from contamination by microorganisms from the healthcare workers' hands. So gloves are single-use items and changed after each procedure to further minimize the risk of infection. So separate pair of gloves is used for the separate procedure or for the separate patient, and for the same procedure patient, if the gloves are spoiled, then you have to, for the same patient also, you have to change the pair of gloves. So gloves are worn when dealing with blood or body fluids such as synovial fluid, peritoneal fluid, amniotic fluid, pleural fluid, any wound or broken skin, handling chemicals or disinfectants. So while handling chemicals and disinfectants, we can use domestic or industrial gloves. Second is gowns or apron. So purpose of wearing gown and apron is to protect susceptible patients from infection and protect the healthcare worker from contamination. So, and it is a uniform or clothes they are used in a clean and dry state. So gown and apron should not be worn outside the area they are intended to be used. Remove gown and apron when moving out of area. Then face protection. So protective eye or face wear are considered where risk of blood and body fluids splashing into the eyes, the possibility. So or while preparation of cytotoxic or chemotherapy drugs, and then during the physical decontamination or cleaning of the instruments. Then mask. So mask offer protection against potential splashing of the mouth and face during certain procedures such as minor operation, physical decontamination or cleaning instruments with a brush. So there are two types, surgical mask and N95 mask. So surgical mask mainly used for during surgical or dental procedures, and N95 mask were mainly used attending the patients with acute pulmonary tuberculosis or nowadays the pandemic of COVID-19. So now what are the precautions? So they should be fitted and worn according to the instructions, not touched by hand while being worn. Then cover both mouth and nose, should be removed as soon as possible if they become moist or spoiled, and removed by touching the straps, not by touching the mask. And then hand hygiene should be there after removing the mask. Shoe cover before entering the ICU, operating theatre, dialysis or CSSD room. Then protective footwear. Again, footwear is also important to protect legs from the sharp injury. Then head cap covers the hair of the healthcare provider in order to prevent the contamination of sterile high risk areas. So here you can see these personal protective equipments used by this person. So eye protection, then face mask, gown, and then shoe cover. So now how to wear that? It is called as donning of the PPE. So wearing of PPE is called donning, and removing of the PPE is called doffing. So the main sequence for donning is first to wear gown, then mask, then goggle or face shield, and then in the last gloves. Doffing, so while removing, first you have to remove the gloves because they are soiled. So first you have to remove the gloves, then goggle or face shield, then gown, and then in the last mask. The rational use of gloves. So how to wear gloves? So first you have to use your dominant hand, then with help of first hand hygiene is important. After that dry your hands and then put your one dominant hand inside the one glove, then with help of second glove you can use with the gloved hand, and then use the another hand, then insert and then wear it properly. So while removing, pinch and hold the outside of the glove near the wrist area, then away from the wrist, turning the glove inside out, then roll it in a gloved hand. Then in fourth step you have to put your ungloved hand inside the gloved hand with help of fingers. Do not touch the outer surface of the glove because now your next other hand is ungloved. Then peel downwards away from the wrist, turning the glove inside out, and then continue to pull the glove down and over the inside out glove being held in your gloved hand. So the one first glove you have to put inside the another glove and then put it in a bin, and then hand hygiene. Now how to wear mask. So in mask, in this picture you can see these total 6 steps. So how to wear a mask? So first you have to do hand hygiene, then wear mask by holding straps, then pinch to ensure no gaps are left, and then secure properly underneath your chin and then over the nose tightly. How to remove mask? Wash hands thoroughly, remove mask by holding the strap, then discard single use mask, wash your hands again. So what is respiratory hygiene? So while coughing, sneezing, we should use of tissue paper, or we should do it in our inner elbow so that it is not forming aerosol or droplets and then not contaminating or transmitting that infection to other persons in that area, that hall or the theater or where the crowded place is there. And then hand hygiene should be done after contact with the respiratory secretions. Cover nose, mouth with mask while surgical mask or N95 mask. So the respiratory hygiene and cough etiquette. So the strategy is targeted at the patients and accompanying family members and friends with undiagnosed transmissible respiratory infection, and then this applies to any person with signs of illness including cough, congestion, rhinorrhea, that is running nose, or increased production of respiratory secretions while entering a healthcare facility. So if anyone is having symptoms like cough, sneezing or sputum production, then that person should take precautions. So what things they should know in cough etiquette? So the education of healthcare staff, patient and visitors they should know about the respiratory hygiene. Then they should cover the mouth or nose with tissue or cloth while coughing and sneezing. Then hand hygiene after contact with respiratory secretions, they should maintain distance minimum more than 3 feet for respiratory infection in common meeting areas. Then mask should be provided to coughing patients. Then healthcare personnel are advised to observe droplet precautions, that is wearing mask, hand hygiene while examining the patient. Then they should be advised to avoid direct contact with the patient, especially high risk patient, and then they should wear mask while taking care of the patient. So in spillage cleaning, you should wear gloves and gown, wipe up the spill immediately with absorbable material, wipe that area with 10% sodium hypochlorite, then remove your PPE and perform hand hygiene. So in spill kit, what things should be available in high risk area like laboratory, sample collection room or wards. So in that for blood, the PPE should be there of gloves, apron, mask, shoe cover and eye protector. Then absorbent material like newspaper or blotting paper, tissue paper should be there. Then water collection bag should be there. Waste collection bag should be there. Then scoop and scraper, disposable forceps, buckets, mops and signage board for the no entry till you remove that spillage. So this is a steps for the blood or body fluid exposure spillage. So in that, keep signboard first, then wear PPE, cover it with piece of paper or absorbent cloth, then pour 1% hypochlorite solution on the spill. Then for major spill, wait for 30 minutes for the action of disinfection. For minor spill, you can wait 10 to 20 minutes. Then wipe the area in a circular manner and put the collected material in a yellow cover bag. Mop the area with disinfectant. Send the incident report form to infection control nurse. Hello students, chapter 19, injection safety. So today we are going to discuss on injection, that is needles and sharps injuries and safety precautions regarding that. So the practice to prevent transmission of infection between patient and healthcare worker during preparation and administration of injection is called as injection safety. So needle stick injuries are puncture wounds, cuts or scratches inflicted by medical instruments intended for cutting or puncturing like cannulae, lancets, scalpels that may be contaminated with patient's blood or other body fluids. Contact of blood with non-intact skin and contact with mucous membrane like eye, mouth and nose are also included under the term needle stick injury. So potentially infectious specimens are blood, genital secretions and all body fluids like pleural fluid, peritoneal fluid, cerebrospinal fluid, synovial fluid and other specimens contaminated with visible blood. Potentially non-infectious specimens are feces, nasal secretions, saliva, sputum, sweat, tears, urine, vomitus unless they are contaminated with blood. So if they are free from blood, then they are potentially non-infectious as compared to the blood and contaminated blood specimens. The activities associated with needle stick injury are while handling or transferring specimens, improperly disposed sharps, recapping of the needles, hand passing needles or shafts after use, during cleaning procedures, or in surgery like the passing of needles and shafts in surgery. Factors for needle stick injury. So it is type of needle. So hollow bore needle is of high risk. Devices visibly contaminated with blood they are high risk. Depth of injury, volume of blood, viral load, delay in first aid, delay in post-exposure prophylaxis, reuse of syringe, overuse of injections, unsafe sharps waste management, mishandling of improperly secured body fluid containers, working in rush and under stress. So this is also very important point. If you are working under stress, then chances of accidents are more. Then prevention of needle stick injury. So first is precaution during handling the needles or sharps. So first is hand hygiene. So you have to do hand rub or hand wash with either sanitizer or with the antimicrobial soap. Then proper wearing of the personal protective equipments. So very important is gloves, and then the apron or face mask. Then work surface disinfected with 10% sodium hypochlorite solution. Whatever procedure you're doing, that is catheterization, taking sample, giving injection, so there should be aseptic technique, that is the part of the patient is cleaned with the proper disinfectant. Then only you do proper sterile materials should be used, so proper aseptic technique should be there. Then disposable syringes and needles should be used. So reuse of the syringes and needles is not advised. So whatever syringes, needles, scalpels, vein flow or catheter, whatever thing we are using, that should be disposable. So only one use and then throw that. So throw in a proper container. The needles are not reused. Previously, few years back, doctors or paramedical workers used to use needles after boiling with water, but then proper time and proper sterilization not completed, and then there were the chances of the transmission of infections like HIV, hepatitis B, HCV. So needle syringes are not reused. Needles should never be capped. So that while capping also there are chances of accidents, so no capping of the needles. Needle and sharps not left on trolleys and bedside tables, so they should not be left on a trolley without putting them in disposable container. Disposal of used needles disposed into sharp box immediately after use. Use of vacutainers for blood collection, so preferably vacutainers should be used for blood collection. Medical vials should be cleaned with 70% alcohol. Medication should never be administered from same syringe to multiple patients, even if different needle used. So this is very common practice in general practitioners, but then there are also chances of transmitting infection. So same syringe should not be used for the many patients, even if different needle is used. So many times it happens, we see that the needle is put in a syringe is put in a antibiotic solution, and then only needle is changed, and then the doctors are giving injections to many patients from the same syringe. This should not happen. Intravenous set should never be used for more than one patient. Spillage of blood and body fluids should be cleaned thoroughly with 10% sodium hypochlorite solution. Minimize use of injections. So wherever necessary, oral drugs should be prepared and advised. So invasive procedures, injection should be deferred. Healthcare workers should be vaccinated with 3 doses of the hepatitis B vaccine, that is first dose, then second dose after 1 month, and third dose after 6 months, so 0, 1, 6. So hepatitis B vaccine is available, so every healthcare worker should be vaccinated, because for other HIV and other HCV vaccines are not there, but what vaccine we are having, that we should use. So precautions during surgical procedures. So many accidents happen because in surgery many sharp objects are used, like scalpel, blade, forceps, needles for suturing and all. So precautions are very important. Then sharp instruments should be passed on by non-touch technique, not directly by hand to hand. So they should be kept on some tray over the some green cloth, and then they should be passed to the surgeon. So suturing, needle holder should be used for the holding needle while suturing. Pre-operative investigation should be done, HIV, hepatitis B and HCV. Then blood-borne viral infections, positive patient, in that use of double gloves should be there, trained staff should be there, and case posted late in the list. After that case, decontamination of OT should be done, and surgeon should wear proper personal protective equipments including double gloves. So injection safety, practice to prevent transmission of infection between patient and healthcare worker. Hello students, today we will study about transmission based precautions. So what are the types? They are contact transmission, droplet transmission and airborne transmission. So what are the causes and what we have to do for that? So what are the precautions? So first is contact transmission. So where it can happen, so respiratory droplet settles down on floor and surfaces, inanimate objects, any one of at a later stage when touches the floor, surfaces, door handles, inanimate objects, etc., and then touch face, nose, mouth, eyes, virus can easily spread. So here you have to take proper precaution, that is hand hygiene, the most important precaution. Then second is the droplet transmission. So it can happen where the respiratory droplets produced when the infected person coughs or sneezes can infect the persons by sitting on their mouths, noses or eyes who are within 1 meter distance. So the most important precaution here is a surgical mask if within 1 meter of the infected case. Then third one is the airborne transmission. So airborne transmission from person to person over long distances is unlikely. So aerosol generating procedures like during aerosol production in tracheal intubation, open suctioning, non-invasive positive pressure ventilation, tracheostomy, cardiopulmonary resuscitation, manual ventilation before intubation, bronchoscopy, airway suction, chest physiotherapy, nebulizer treatment, sputum induction, collection of specimens, or in laboratory when we are doing centrifugation, transferring sample from one place to another. So these are the situations where we can get airborne transmission and of the organisms, and the most important precaution here we have to use the mask, that is N95 mask. Now we will see what are the causative organisms. So for standard precautions, organisms are cytomegalovirus, HIV, hepatitis B, C, aspergillus. In contact precautions, the organisms are MRSA, then VRE, vancomycin resistant enterococci, adenovirus, diarrhea producing Clostridium difficile, rotavirus. So these are the organisms. In droplet, pertussis, influenza, Neisseria, Coxsackie, bacterial meningitis, mumps, rubella. In airborne, it is chickenpox, then measles, tuberculosis, SARS, and avian influenza. So now we will see in detail. So first one is contact transmission. So it can be of two types, direct and indirect. So indirect, it is through the contaminated hands with blood and body fluids. Indirect, from the clothes, patient care devices or environmental surfaces like floor touching the door handle of the door and etc. The agents are most commonly are methicillin resistant Staphylococcus aureus, Acinetobacter, Pseudomonas, adenovirus, chlamydia, group A streptococcus, staphylococcus, rotavirus, vibrio, Clostridium difficile. So precautions here. So most important step, first one is the hand hygiene. Alcohol based chlorhexidine mixture of the sanitizer should be used for the hand rub or hand wash. Then personal protective equipments like gloves, surgical mask. Then single use patient dedicated equipment should be there, and patient should be placed in isolation room, or cohorting can be done. So cohorting means when the same group of symptoms if present in many patients, then they can be kept in a room together. So the space should be more than 3 feet. With the curtains you can isolate the patient. Second one is the droplet infection. So when it can happen, so respiratory droplets are more than 5 micrometer in size. So during cough, sneezing or talk, these droplets can spread the infection. So agents most commonly are diphtheria, the Corynebacterium diphtheriae, H. influenzae type B, meningococci, pertussis bacteria, then plague, mycoplasma, streptococcus and influenza. The precautions we have to take here is first hand hygiene, alcohol based or chlorhexidine based, then personal protective equipments. Healthcare workers should wear surgical mask, respiratory hygiene and cough etiquette, that is proper cough procedure using clean cloth or tissue paper, and while coughing you should cover your mouth and nose. Then patient placement, it should be in isolation room. Cohorting can be done, so space should be more than 3 feet with the curtains applied for the separation in between patients. Then patient should wear surgical mask in transport, and then healthcare workers should wear the surgical mask, and disinfection of the room is there while discharge of the patient. Now third type is airborne transmission. So in that, aerosols less than 5 micrometer in size are produced during cough, sneezing or talk, and then it can be produced in procedures like endotracheal intubation, tracheostomy, sputum induction, bronchoscopy. And the microorganisms responsible for this is Mycobacterium tuberculosis mainly, then measles, varicella, SARS-CoV, COVID-19, MERS-CoV, smallpox, anthracis and aspergillus. So precautions, the first most important step is hand hygiene with alcohol and chlorhexidine used in that. Then PPE, healthcare workers should wear N95 mask or high level respirator, and it should be tested whether it is fit or not. Then respiratory hygiene and cough etiquette should be followed, like while coughing or sneezing you have to cover your mouth and nose with help of clean cloth or tissue paper, or if it is not there then in the elbow you should cough or sneeze, so that aerosols are not produced and they are not transmitted to the environment. Then patient should be isolated in room with negative pressure. Then UV irradiation or HEPA filters should be used in that room. Then patient should wear surgical mask, and disinfection of the room is there after the discharge of the patient. Visitor and staff should be entry is restricted, and if they are visiting then they should wear PPE, that is mask, gloves and apron or gown. So in airborne transmission, patients are placed on airborne precautions when they have known or suspected infections transmitted over long distances through the air. So organisms mainly are Mycobacterium tuberculosis, measles virus and varicella zoster, that is chickenpox virus. So airborne infection isolation room, AIIR. So ideally patient should be placed in that room. Remember, this is room specifically designed with a special air handling and ventilation system to prevent transmission of airborne infection. So it should include negative pressure, that is air flows from corridor to inside the patient room but not from patient room to outside, and 6 to 12 air exchanges per hour. So direct exhaust of air to the outside, away from places where people walk or congregate, and at any intake openings. A door kept closed when not required for entry and exit. Now we will see what are the definition of infection control nurse. So this ICN is a registered nurse with additional academic education and practical training in infection control, clinical and diagnostic microbiology, epidemiology and computer technology. So the duties to the ICN is a bridge between HICC and wards and ICU. So the ICN should go on rounds and visits all hospital location, control and monitors these healthcare workers for the infection control measures, then identifies the problems and implements appropriate measures, then collection for healthcare hospital acquired infection surveillance, hand hygiene audit, then PPE audit by daily visiting, then implementation of transmission based precautions, disinfection policy, high risk areas, environmental surveillance, education of healthcare workers and patients, provide post exposure prophylaxis for needle stick injuries and maintenance of the registers, then staff vaccination program for hepatitis B virus and influenza, and involved in antimicrobial stewardship activities. So these are the duties of the infection control nurse.
Hope you find this session useful for your understanding and for your exams. Thank you.